Welcome. My name is Sarah Ammons, and I am an orthopedic and pelvic health physical therapist here at Texas Children's Hospital Pavilion for Women. Many people don't even know that pelvic health or women's health physical therapy exists. Almost every week or every other week I hear, what is this and why am I here? And I didn't even know this was a thing. But most patients end up being very happy after they learn that we can help them a lot with what's going on with them and their symptoms. So the goal of any physical therapy is to decrease pain and improve mobility and function. As a pelvic health physical therapist, we are especially addressing muscles, joints, nerves, and tissue in the pelvis and back and surrounding areas. But we also have to have a lot of knowledge about bowel and bladder function, sexual function, and all the problems that can go wrong with all of these areas that you'd be seeing all these other physicians for. As you can see in the picture, there's a lot going on in a really close space. So I love this picture of the pelvic floor muscles and how close they are to the bladder, the uterus, and the rectum. So a lot of the times, you might be having multiple symptoms, and a lot of those symptoms might be related to each other because they're so close. Urinary urgency sometimes can be due to tight pelvic floor muscles, but you also might have constipation too. So all of these can be interrelated. So we're part of the team that's addressing all of these issues, conditions that you've heard about tonight, and we'll also hear from Dr. Guan. Many of these issues, the pelvic floor muscles are often responding to what's going on in the body. You might have had some fibroids that cause some pain, and the surrounding muscles then are contracting in response. Sometimes, such as vaginismus or vulvodynia, the pelvic floor muscles can actually be a driver of the pain itself. Either way, we're going to address what we find in clinic, and if there's muscle imbalances, we're going to address that. So what do we do? When you come to physical therapy, your therapist will do a thorough history and evaluation. Your history, we're going to ask about your medical history, past surgical history. We're going to ask about your gynecological history, how many pregnancies you might have had. And then we want to know about your pain. I want to know your story. Every person is here tonight has some kind of story and has had pain going on for usually quite a while by the time they get to see me. Then I'm going to ask about your history of your pain, what your present symptoms are, your past symptoms, and how your symptoms might have changed over time. We'll go in depth into bowel and bladder function. I'll ask you how many times a day you're peeing, what your poop looks like. There is no such thing as TMI in the pelvic floor treatment room. So we also definitely want to know about your sexual function. Are you having pain with intercourse? All these conditions can cause a variety of symptoms, so we'll get really into depth to all those symptoms. Then we'll do a musculoskeletal exam and a pelvic floor exam, and then education about your condition and the treatment plan. So if you've been to physical therapy before for another condition, your musculoskeletal exam is going to look pretty close to what you'd see for a typical back pain or hip pain. We're going to look at your range of motion, your muscle strength, your posture, some functional activities. So we want to see what else is going on in the rest of the body to have a holistic view of what is going on at the pelvic floor. Lots of times, areas in other parts of the body, such as if your thoracic spine isn't moving well, that can affect your low back, which then can affect your pelvic floor muscles. Sometimes we'll find occasions where your pelvic pain might be caused by a hip labral tear, but instead of having hip pain, you actually had pelvic pain. So we do hip tests that are going to help identify that kind of thing. Then most patients, either on the initial evaluation or on the first return appointment, will do a pelvic floor muscle exam. This looks a little bit different than a gynecological exam. We don't use the stirrups or speculum, but we will have you undress from the waist down, have you lay down comfortably so you can actually relax your muscles well. And then we're going to take a look externally and perform an internal assessment to look at the tone of the muscles. Is there tension in the muscles? Is there spasm or an involuntary contraction like Dr. Hahn was talking about in vaginismus? What is the coordination of those muscles? Can you contract the muscles? More importantly, can you relax the muscles? Most of the time with pelvic pain, we find that patients have a much harder time relaxing the muscles. Sometimes we find that the patients can't contract the muscles at all, And it's not because they're weak. It's because they're so tight they can't let go. So I use my arm as an example all the time. When we go to the gym and we work out our arm, we want to have full range of motion. We do our bicep curl all the way up, all the way down. If you're walking around with your muscle like this and I ask you to contract, it doesn't go anywhere. So it looks like it's weak. So if you go to your doctor and you say, oh, I'm leaking, I have incontinence, and they do the contraction and it's like, oh, well, that looks weak. Let's give you some Kegels. Don't do that. If you're already have an overactive muscle and you try to strengthen it, well, number one, not effective at all because you're not going through the whole range of motion that that muscle has. And number two, that it can actually make your pain worse. So the coordination is a really big deal. And one of the things that we concentrate most on retraining your pelvic floor muscles. Also, I just love these pictures of the pelvic floor. It's really hard to visualize, and even back when I was learning all of this, that's the one part of anatomy. Normally when you learn anatomy in PT school, they give you all the 2D images, and the pelvic floor is really, really 3D. So you really have to kind of try to envision it from all different angles. So one thing that people don't know a lot is what is normal? How many times a day should you pee? What is your poop supposed to look like? People don't know what's normal, so sometimes they don't even know to bring up symptoms with their physicians. So one thing that's very important, what we do is education of what's normal, and we educate you on how you can improve the symptoms you're having to improve bowel and bladder function as much as possible. Constipation is so common, and especially in pelvic pain, that can make things more uncomfortable when you already have pain, and then when you have tight muscles, it then increases the constipation. So we kind of get this cycle going. Also, when you have constipation, that can also make your urinary incontinence worse. So we have to look at the whole picture of everything. There's many ways that we can address urinary issues. One of the things we like to do is correct poor habits. You should definitely sit on the toilet. You shouldn't hover. So the just in case is, do you go to the bathroom just in case? I'm about to go somewhere. Let me go just in case. And so we don't want to build up poor habits that might exacerbate issues we're already having. And then fluid management can be very important too. And Dr. Ortewella had brought up some bladder irritants, so that's something that we also address. If you're coming to talk to us about pain neuroscience education is actually going to be part of your treatment. When you have pain, your muscles are going to react to that. Over time, that's going to make your body more sensitive. Your brain is there to protect you, and pain is an alarm to help protect you. But when you've had pain for a long time, it doesn't become protective anymore. It becomes a problem. The good news is that there's different treatments that we can do to take that centralized nervous system that Dr. O was talking about and calm that nervous system down. And so some of our treatments are directed at the whole body, and then some treatments are directed specifically at the pelvic floor. But ultimately what we're trying to do is start a new conversation with your body and your brain to calm the nervous system down and then let those muscles relax. Definitely exercise, good quality sleep, education about pain. All these things can help lower your pain as well. And then also bringing up the cognitive behavioral therapy or any kind of talk therapy can be hugely helpful, not only to address issues that may have happened in the past, but also because this is pretty much a private issue. You don't post on Facebook, well, other than the endo group. You don't generally post to your normal friends on Facebook like, oh man, my pelvic pain was really bothering me today, as somebody would if they broke a leg. So you don't get that same sympathy that we get in society in general. So pain treatments often start with breathing. A lot of the times, people will breathe from their shoulders up, essentially. As you can see in the picture, as you breathe, what should happen is your diaphragm should drop down, and then your pelvic floor drops down with that. If your abdominal muscles and your pelvic floor muscles are really tight, and you're only breathing up in your chest, then that doesn't happen. And so if you're normally breathing like this and getting a good breath in, you breathe about 13,000 times a day, that pelvic floor is getting a good workout all day long. But if you don't breathe like that, then it just stays tight if you have a pain problem going on. Graded exposure is another way that we start to introduce people back to the activities they want to do. When you've had pain for a long time, you might have quit exercising, you might not be having sex anymore, you've built up a lot of that fear, especially with the vaginismus conditions. So graded exercise is kind of like if you're afraid of heights and you're going up a staircase, you're going to take one step at a time. Take the one step and wait till you're ready for the next one. We do the same thing and introduce a little bit of exercise, introduce speculum training. We can do all sorts of things to do that stepwise progression to get you back to the activities that you want to be able to do. This is one way that we do that graded exposure training, either a wand program or a dilator program. On the bottom, this is a set of dilators. Often the smallest one, my finger is about in between number 1 and 2 there, so they start pretty small. And there's a number of different companies that make these, so we can get any size pretty much that we need. But we can slowly introduce this dilator training to get somebody to be able to tolerate vaginal insertion again. The wand also can be used for stretching, for mobilization of scar tissue, and to help relax the different muscles internally. Manual therapy can do wonders for addressing tightness going on in the body. Joint restrictions, tight connective tissue, tight muscles, all of those things that build up from lack of normal movement or just a general overall tightness from those muscles just being overactive for too long. Externally, we'll work on the spine, the abdomen, the hips. Internally, we will work on the pelvic floor muscles themselves. And then exercise does wonders. A lot of people stop exercising because they have the pain. And so that's one thing we do is help you regain that exercise because increasing that blood flow can be great for pain relief. Stretching is often first-line treatment. You usually go home from your eval with at least one stretch. The home program is a very valuable part of physical therapy. It's not all what you just do when you come to treatment. That home program is going to be the main driver. And that might consist of stretching, specific mobility exercises. It might consist of a voiding program to address the bladder issues, education about correct pooping posture for constipation. So the home program is a really important part of what's going on. So how do I get to physical therapy? In the state of Texas, referrals are required for treatment past 2 weeks. And then Texas Children's just requires a referral for evaluation. So you can ask any of these nice, lovely doctors for a referral. You can also get a referral from your PCP, physician assistant or nurse practitioner. This is the number to call if you want to schedule at Texas Children's. Physical therapy usually is covered by insurance. Of course, everybody's insurances are different, so it just depends. Pelvic health physical therapy is covered just like any other physical therapy that you'd get for your back or knee or shoulder. And so usually, sometimes there's a visit limit or a copay. So that would follow the same rules for your insurance as any other physical therapy. The frequency and length of care is going to be highly individualized. So you're going to meet with your therapist, you do the evaluation. At the end, you talk about treatment plan and options. Sometimes we have people that live really far away, can't come in very often. They might have insurance limitations. We're going to work with each patient to devise a plan that's best for them. Sometimes we see people more on a consultation basis, and then sometimes we're seeing patients on a regular basis for a couple months. It all just depends on what your symptoms are and also what your goals are. So just like your home exercise program is individualized, your entire treatment plan will be individualized because everybody's going to present differently and everybody wants to get to a different place. So I just want to say that physical therapy can be so helpful, and I personally just feel really honored and privileged to be able to work with all the pelvic pain patients I've seen and able to help them get back to improving their quality of life.